Carrie Biondi, the Senior Director of Marketing and Operations for the Sanford Health Foundation, and this is my Blue Chair story. So I am from Sioux Falls. My husband and I have 2 children. Back in 2019, we had one little girl named London and wanted to grow our family. We were able to get pregnant in January of 2019 with the great news of knowing that we were expecting a baby in January of 2019. We also had extremely tough news. We found out that my sister was diagnosed with terminal cancer. I remember the phone call I got from her. She hadn't been feeling well for weeks and went in for various testing. I was in absolute shock. I almost felt paralyzed. I couldn't move. So Kristen's cancer was an extremely rare cancer. It only had a 5% survival rate. We knew that she would be terminal. My sister and I were really close. We texted at least every day, if not talked on the phone every day. It was an interesting time of life as I was caring for my only sister who was in her 30s, living far away, trying to coordinate medical care and just making sure that she physically and emotionally was okay, while also caring for my daughter and myself being pregnant, and also still working every day full time. I just remember a few times where she would throw up in the shower upstairs, I would throw up in the shower downstairs. It was awful. They unfortunately found a rare pregnancy complication called vasa previa. Reflecting on that time, it was truly a God moment for me. I was forced to slow down, take care of myself, but also take the time to talk to my sister for hours on end every day. So we would just connect and reminisce over good times and share photos of her going into treatment, me in the hospital bed connected to monitors, and sending her videos of back kicking in my stomach. And so I had a scheduled C-section. Beck was born at 35 weeks, then went to the NICU. Our time in the NICU was limited at just 2 weeks, but you feel loved. I was able to take this new baby home, get comfortable, and after about a week of being home with him, I had to fly to Salt Lake City. I knew that it would mean the world to my sister to meet her new little nephew, and spent about a week and a half with my sister. She started to do a little bit better, but we ultimately knew that her time with us would be limited. Losing my sister was extremely hard. It allowed me to reflect on what matters most, and I made the decision to leave my career in advertising. I needed a reset. I needed to spend time with my family and friends and take care of myself emotionally. I needed that because losing my sister left a very, very big hole in my heart. And during that time when I was at home, I was approached by a few Sanford leaders and told about an opportunity to help lead marketing and operations for the Sanford Health Foundation. I thought it would be an interesting juxtaposition of my professional talents and then my passion for healthcare, and to be able to come in and be a part of the Sanford family, contribute to our overall mission, truly see the way that donor dollars are at work every day around us is beyond meaningful to me. I vividly remember working on a Roger Maris Gala video shoot and highlighting the wonderful care that happens every day at that amazing cancer center. And we really leaned into hope and patience ringing the bell. And it was really hard for me. I never got to see my sister ring the bell. I have a big picture of her behind my desk as just a reminder to come in and help people in their hardest and most vulnerable moments of their time. There's a constant reminder that life is fragile, and there is this culture of family first here at Sanford, and I think we live that out every day because we see what's at the other end, and that life is a special thing.